Hate to say I told you so, but you know what? Hey, Jason Kenney folded. In fact, he folded on Friday, man. I was out and about over the weekend, and I noticed a massive influx of masks, and because I find that idiotic, I will not be complying. Now, you know what? Because this is YouTube, and there are certain things you can't advocate, like I can't tell you to break the law, but I can tell you to not adhere to anything that you find morally compromising. And you know what? Especially when there is no repercussions to doing so. If you find yourself in a similar situation as I do, that I am, you know what? Hey, I'm done giving a fuck about all this type of stuff. I'm just going to let you know that, you know what? This is a toothless order. If anybody tells you to just shut up and wear your mask, you just politely tell them, no thanks. Because there's nothing in here that is enforceable. These are just all words by idiots, okay? This doesn't even come from the fucking premier, okay? This comes from Dr. Dina Hinshaw, who looks like a lonely old man got his wish to make his scarecrow fucking anthropomorphic. Chief Medical Officer of Health, whatever, have initiated an investigation into the existence of COVID-19 within the province of Alberta. It's here. There are cases. It's just not as bad as you're trying to tell us, okay? And I've got the numbers. I've seen the documents. We have the research. Whereas the investigation has confirmed that COVID-19 is present in Alberta. Okay, cool. At end of the story, just sign off. We're going to have to live with it. And constitutes a public health emergency. Really? Oh, okay. What's the threshold of that? Care to quantify any of that? As a novel or highly infectious agent that poses a significant risk to public health. Significant risk, huh? Okay. But the order's not that long. It doesn't have a drop dead date, but all of this came effect September 4th at 8 a.m. Mountain Standard Time, which is all of Alberta. So you know what? Hey, you know what? Might as well be specific. But what does it do? Well, it's just all about masking. Okay. Masks are mandatory in all indoor spaces and workplaces. Employees must mask in all indoor work settings except while alone in workstations. Schools are not required to implement masking ... yet, but school boards will continue to set COVID. Oh, okay, cool. So we don't have to. So the school boards will. Know who your trustees are, especially here in Grand Prairie, because we're going through an election right now. So it might be boring and it might be niche, but in the next couple of weeks, because the special municipal election isn't coming up for like a month here, it's totally fucking bonkers. But hey, whatever, that's what we got. Masks are not required while participating in physical fitness activity, performance activity, or a worship service at a place of worship. That's cool. And something else that is completely retarded. So, okay, I don't partake in alcohol. I don't partake in any sort of extracurricular activities. I don't know what the fuck you want to call it. I'm a boring dude, okay? All I do is just read and write, okay? But I think that this is absolutely fucking preposterous. This is what happens, man, when you give these morons fucking authority on everything. Alcohol service must end at 10 p.m. Because what? That's the virus's bedtime? Like, okay, you can still have a pop, you can still have some fucking water, but alcohol, that's different. Why? Nobody's ever come up with it. It's like, why? Just, okay, you can still hang out, but everything alcohol related has to go away. But how is this enforced, right? Okay, are they going around knocking on doors, knocking over mailboxes? Well, I've looked through the fucking order. I've seen that there is no penalties, no nothing like that. So I'll link to it, of course, but is it just another one of those compliance measures where they just want you to submit? They aren't trying to enforce it. They just want you to submit because masks save lives or something stupid like that, because they were so effective when we had them over. Let's just see here. Let's run it back to last year from October through July 1st, wearing masks all the time. That worked so well that now we have to go back to masks. Oh, okay. It's almost like some dashingly handsome man told you this was exactly what was going to happen, okay? But, okay, what's with all of this, okay? Oh, it's from a spike in cases in Alberta. You got to believe it. The hospitals are getting overwhelmed. Once again, we have the case numbers, and I'll just refresh for posterity's sake, because maybe since the time that I updated or pulled up this page, my mistake, it's been there for a while. We've been talking about other topics for a very, 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 very long time today, but that's cool. That's fine. Yeah, okay. Look at this. This is what you have: 822 people in hospital. Okay, and we're supposed to be taking care of our precious socialized Medicare. Okay, or whatever the fuck you want to call it. That disaster zone that we have is the Queen Elizabeth Hospital. Well, that other one, I don't know what it's supposed to be called, but it's over on the bypass, and it's literally been being built since I was in fucking high school. I'm 31 years old. Okay, before I got into high school, they were working on building that fucking hospital. Okay, and it's not even close to being complete. But healthcare is right. Well, let's see how well they're doing this. Okay, so there are 18,000 cases, 18,265 cases in the entire province of over 5 million people. Okay, not exactly a big number. Okay, in Calgary, okay, where they have a population of over 1 million people, you got 5,100 cases, 229 people in hospital. Okay, Edmonton, which again is over that 1 million mark, 5,323 cases, 291 people in hospital. Why? Why? If you think you need to do something, maybe in Calgary and maybe in Edmonton, I wouldn't advocate for it, but if you were taking a measured response to this, you would just take a look at the areas most affected, because then you got the central zone, which has like Red Deer and then a bunch of the suburbs of Calgary and Edmonton as well, which makes up another big chunk of the population base in Alberta. They have 2,700 cases, okay, 134 people in hospital. There are a ton of hospitals that are there as well. And we're going to get into the amount of beds because I forgot. But again, I'll just go ahead and spoil the surprise. There's 10% of the beds that are in the entire province that are being taken up. Okay. And then in the south zone, so you have, I think Lloydminster would be taken up by the central zone, but you have Medicine Hat, you have Lethbridge, big population centers as well. 1,800 cases. Okay. 83 people in hospital. And then you got the north zone. Okay, where I live, okay? That is everything north of Edmonton, okay? And that, if you've seen how Alberta is situated, if you're unfamiliar with the geography of Canada, I don't blame you. It'll eventually just be one big red homogenous fucking socialist blob, so that's fine. Borders won't mean fuck all soon enough because, well, all of the premiers are thinking exactly alike, so what's the fucking difference? We just don't have a PST right now. But up north you have, okay, Fort McMurray, which is on one side of the province, and then like I said, yeah, so the geography, that is, okay, because Alberta, it kind of looks like a Down syndrome head. Follow me on this one. It's got a big old forehead and it's got kind of a crooked little fucking nose at the end, and then it just has no chin by the end of it, and it just kind of sinks into the shoulders that is the United States. Anyways, so Grand Prairie is just off that little retarded nose, and then at the back corner is Fort McMurray, and then you have a lot of open space in between, mostly because it is just a frozen tundra 6 or 7 months out of the year, so you have a lot of fucking space there, and you got 3,200 cases, and 85 people are in hospital, okay? We're doing it the best by taking a look at active cases and people in hospital right now. It looks like our numbers are doing the best, but hey, that's why we need masks up here, right? Really good response on things, okay? And it gets even dumber from there, especially when you take a look at vaccination rates. So, okay, apparently we're giving the kids the poke once they hit 12 years old, which questions for other platforms. Anyways, I'm sure it's safe and effective, right? Yeah, so from 12 to 50, so you got like 70% of kids aged 12 to 14 have received at least one poke, 71% of 15 to 19-year-olds, and then everybody after that, we're looking at a 79.2% one poke vaccination rate of everybody over the age of 12, and 71% fully vaccinated. Why the additional restrictions if everything is supposed to be on the up and up when it comes to the poke? So we got 3 different kinds. We've got the AstraZeneca, which will be fine for within Canada. It's not really recognized as being something that is applicable when you're flying abroad. So, you know, we got the Moderna and I think the Pfizer. I don't know. I don't care because I'm never going to be signing up for it. But then, oopsie daisy, you start to get into some really problematic numbers here because of the 5.6 million jabs that have been handed out rather. Oh boy, there's like a 2.5% adverse rate of side effects from getting the jab. That's interesting. What's the survivability rate of this disease again, of this virus? Oh yeah, okay, cool. Allergic reaction, non-specific on that one, 447 people. Severe diarrhea or vomiting sounds like a great time, hopefully out of both ends at the same time, but at least you got the jab. Make sure you keep that tattoo appointment so you can constantly be reminded of your great decision. 139 people have experienced that. Rash, 159 people. I guess that's different than allergic reaction, whatever. An adverse event or special interest, or an adverse event of special interest. Can we get clarification on that? Because that's 139 people who have experienced that. Adenopathy, 129 or 124 people, my mistake. Other unusual events. If they're so unusual, why is there 108 people experiencing these unusual events? Shouldn't you fucking break it down a bit? And then pain or swelling, cellulitis. Oh, okay, when your body starts to target fat cells and considers them poison in your body, that's what cellulitis is, and that's great. A poisoning in your body. That's wonderful. That's wonderful. Anesthesia, paresthesia lasting over 24 hours. 58 people have experienced that. Anaphylaxis, 50%. So shortness in breath. Isn't that one of the side effects of the coof? You know, isn't that something you're supposed to be trying to avoid by getting this vaccine? But instead, hey, guess what? Sucks to suck. Bell's palsy. By God, King. By God. 38 people. Let's wait for the love of mankind. 19 people with fever. Guillain-Barré syndrome. Oh. Yes, what people use as a medical exemption to not get the jab. Congratulations, you got the jab. Now you get the thing that precludes you from ever having to get the jab again because it would just flare that, but whatever. And thrombocytopenia, which sounds fun. Then you can get nodules, meningitis, infective abscesses, infective abscess, which just means somebody wasn't fucking cleaning the needle, honestly, or cleaning the site rather. They don't reuse needles. We're not in that big of a hurry. Athemia multiforme. Encephalitis, ADEM, or myelitis, convulsions or seizures, arthralgia, or arthritis. Don't worry about it. Safe and effective, though. That's just only in Alberta. And remember, I'm just reading off of the official Alberta website, so that's what they're telling us is out there. But make sure you get the jab, guys. Safe and effective. But just for a refresher, right? 822 people in hospital. 8,513 acute care beds. About 9% of beds are being occupied by coof patients. Temporary procedures that are in place. And because of those 10% of beds being occupied, AHS postponed scheduled surgeries due to COVID-19. Care of September 3rd, 2021. Oh boy, they're going to try to keep this pandemic going a long fucking time. The rise of COVID-19 cases. This is from the official Alberta Health Services page, by the way, so it looks like they need a new editor. The rise in COVID-19 cases in the community and the resulting demand of hospital resources doesn't seem to check out. Means AHS must take further immediate steps to create additional ICU capacity. 212 people in intensive care in a province of over 5 million people. Okay. AHS is postponing scheduled surgeries and procedures across all zones. All patients who will be affected will be contacted directly by AHS. North Zone surgical postponements of up to 60% are expected next week. Remember, just taking a look. 85 people in hospital, 14 in intensive care. Run through the rest of them, but you know, all the links to everything for you guys to check. This is the official government shit. This is unfucking believable. AHS is maintaining urgent and emergent procedures as well as prioritizing cancer surgeries. Yeah, because we don't need any more excess mortality. Calgary Zone is opening up 5 beds in the pandemic response unit. Oh, located in the there's no self-help here. South Help campus to be used for day medicine patients, not patients with COVID-19. Yeah, because they're just being absolutely overwhelmed. Have you guys seen the case numbers? They've got 62 people in intensive care in a city that has at least 5 hospitals. What do I know? None of this makes sense. None of this is really adding up. But hey, guess what else doesn't? Making sure that your compliance card is printable. Or you can have government tracking, government app on your phone so you can show off your proof of vaccination. But remember, we don't have vaccine passports in Alberta yet. That's not something we're doing. Like, never going back to masks, right? All you need to do is just take a look at this lump of shit's fucking timeline, you'll see that all of this is complete garbage. Complete fucking garbage. He's trying to tell, this is the premier, by the way, Jason Kenney of the I'm a conservative party. Go fuck yourself. I will never support you ever again. Wild Rose Party for life. He's trying to tell you that Alberta is doing better than ever. 128,000 jobs added. Added in the last year. 20,000 jobs added in August alone. Unemployment at lowest levels since the pandemic began. That's great. You keep adding those jobs, but they're at the lowest levels since the pandemic began. Okay, brother, you still have high-ass unemployment rates. You can keep touting all of this shit as long as you want. It just really doesn't mean anything if people aren't confident that their hopes of employment are going to be fulfilled, okay? The jobs are there, but if they're putting vaccination requirements on there, you've seen how many people are vaccinated, and you keep trying to push this. But remember, guys, it's only starting on the 16th. Starting on the 16th, you can print out a card-sized proof of vaccination or show it on your phone, and then even just going back to the government website, who definitely have your back, and somebody I would definitely trust. Starting on September 16th, Albertans will be able to print a copy of their card-sized COVID-19 proof of vaccination or show it on their phone or tablet. Why would you need to show it, right? There's no vaccine passports yet, right? No, he was going to stop doing that. We continue to make it easier for Albertans to securely access their health information, to then just freely give it away to anybody who asks, including immunization records in the palm of their hand and anytime and anywhere through My Health Records. Make it available to your employer as well, definitely, okay? Where there's more jobs added all the time, and that the stricter requirements are only just going to place the burden squarely on the managers and the employers, okay? If they've got a small business or rather a tight-knit group of individuals, they're forced to tell everybody to go get the mask, or go get the jab, rather. You still have to wear a mask, though. Don't worry about that. So what's the incentive? You can keep your job. Well, guess what? There's more jobs opening up all the time, and it's just as easy to make a lateral move, tell you to go fuck yourself, because this right now, this economy that's on the come is a buyer's market. There's more openings than there are people to fill those openings, so shop accordingly. More Albertans are signing up for this tool every day because they are, in fact, the thing you're describing. And if you haven't done so already, I encourage you to sign up now. Fuck off. I already know you're probably tracking me in some form or fashion because, hey, if it's not directly the government, it's whatever fucking big tech site is out there just tracking your every movement. Why do you think they keep asking for your location services to be enabled? Work is also underway to make proof of vaccination available through a QR code that you can have conveniently just, stickered to your body. A QR code will be easier, faster, and more secure way to share an immunization record when needed. Which again, we haven't told you that we're going to, finally just give up what's left of our rubberized spine and just capitulate to everybody else out there. Hey, they're just waiting, right? These are all temporary measures, right? But what's the old saying? There's nothing more permanent than a temporary government solution. Fuck you, Kenney. Fuck the conservatives, or whatever these liberals masquerading in this conservative skin suit keep pushing. This is horrific. This is truly, you know what? I do love Alberta, but I swear the people at the controls are fucking nuts, and these are the end times. Man, I really didn't want to be a downer to end this, but sometimes it's, it just sucks. I guess maybe next update will probably be when the mandates drop. I ain't giving up though. They ain't gonna make me bow to this shit. Take your mask and pull it over your eyes so it's easier for me to come over with the fucking 1 and 2, you dumb cunts. Thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut. Get after it. Take care, everyone.